Hi again. In the last video, we discussed the HPI. In this video, we are going to be discussing the review of systems, aka the ROS, and the physical exam, aka the PE. The ROS and the PE take the body system by system and describe various symptoms associated with each system. The ROS is what the patient says, and the physical exam is what the doctor finds upon his physical examination. First, let's go over how these two things are entered into the chart. They are both considered macros and can be found under the Macros tab, right here. You can see that a macro refers to a template that can be inserted into the chart identically over and over again with the click of a button. With information that you use often, it is very convenient to use a macro. That is why you use it for the PE and the ROS, because you will use these two things on every chart. Another thing that you will use on every chart is the CYA note, as well as your scribe documentation verification. You can make a macro for this, and your trainer will give you more information about that in your training shift. For now, don't worry too much about the macro process, as I said earlier. Just know that they are there, why they are there, and expect to talk about them more during your training shift. So after I have inserted in my HPI, which you can see to the left, I go to the macros button and click on the appropriate macro. We'll go ahead and click on macros now. You can see that there are all different types, and you will get more information about which one to pick whenever you train. But generally, each doctor has their own macro, and there are different levels. A level 3 would mean a patient was a quick in and out patient generally, and a level 5 would be a more serious case. Your trainer will give you more specifics about this during your training. For our pregnancy test example, let's say that we were looking for an adult level 3 macro. Let's go ahead and click on a doctor. Let's say we're working with Dr. Amoroso. We would look for our level 3, ROS, adult, and then our level 3 ROS exam. And you can see that it just takes a template and moves over common things for each exam. All of this is normal, and we just now have to go through and change the abnormals. That makes it a lot easier because, as I just said, now we just need to change the abnormals. It's a handy tool, but it can be hard sometimes to be accurate. So it is important that you read through each section to make sure that it is correct and that it does not contradict anything. The ROS is once again what the patient says is wrong with them. So let's go ahead and work at the ROS for this example. The patient said that he was having some abdominal pain, so he would just click once to make that positive there. And he was also having some nausea, so he would just click once to make that positive. We can strike through diarrhea since he said he wasn't having any of that, and we would just hit change, and now we can see that it says he has abdominal pain and he has nausea. That's all we do, and now we are done with our ROS, making sure that it is accurate. We'll move down to the physical exam. The physical exam is what the doctor finds. This is generally much more specific and involves medical terminology. Just as you did in the ROS, you will go through the PE and change the abnormals. But always be sure to ask the doctor about this portion of the chart. Never assume. And again, make sure that it is all accurate. So let's say that you are ready to ask the doctor for the physical exam, and he said that the patient had, the patient had some bruising on the head. Well, we would just go through here, X through atraumatic, and we could say that he had a contusion or a bruise, and let's say he said it was to the frontal scalp. We would just hit that right there, and we would still click normal cephalic and hit change. And now you can see that the contusion to the frontal area of the head is now saying that it's there versus saying it was normal earlier. Let's say he also said that the patient had some wheezing. We would click on respiratory. Right now it says he doesn't have wheezing. We would say, yes, there is wheezing present, and he said it was to the left upper lobe. Here again, I'm just making all of this up, but you would ask the doctor for whatever the physical exam is and enter it in as needed. So, that concludes the physical exam and the ROS. And earlier we talked about the HPI, and those are the three main components of each chart. Now we will begin talking about how to discharge or admit a patient in the next video. Thanks again for listening.